Okay, good morning. Let's go ahead and get started. Welcome to Pediatric Grand Rounds. All of our senior residents are required to present a Grand Rounds topic before they graduate. No stress at all, correct?
Exactly.
Okay. And so Tucker has chosen the all-important work-home balance and avoiding burnout, probably because while he's been a resident, he and his wife have had and are successfully raising 2 babies, so no stress there either. I'm going to let Tucker tell us how to do this right.
So I am silencing my phone right now. How's it going, everybody? As Dr. Broussard so kindly put it, my name is Tucker Blackledge, for those of you who don't know me. And I'm one of the third-year residents. So, excuse me, I had to run up here. So, first of all, I'd like to start with a little bit of a faux pas. I'd like to apologize. I do not have a reference slide because what I can describe only as catastrophic technological failure happened earlier today, and I lost about half of my power presentation at 5 a.m. So the only thing I couldn't really salvage is references. I'm happy to email that to anybody who needs them after the presentation. So, you know, I'm one of the chief residents this year along with Kate, and so one of the job descriptions I have is being a resident advocate. So when people were asking me what would I do for my grand rounds, I really wanted to do something that I thought I could help educate myself as well as other people about health and wellness issues in residents themselves. So that's why I chose wellness in residency. I've heard a bunch of burnout lectures about attendings. People have been practicing for 45 years, but I never really got a good understanding of what burnout looks like in a residency population. So I was really interested in that. So I have a little bit of an outline here. First, I think we need to define wellness before we really start to talk about it. I think the best way to do that is to have a model of wellness going forward, because wellness is a multifaceted issue. I think we need to define what burnout really is, because there is a lot more variability there than you'd think. I think we need to look at what complications burnout has for individuals and for the community at large. I think we need to look at what causes burnout and what we can do to combat it. So I'd like y'all, by the end of this lecture, to know how we're defining wellness and burnout, seeing what burnout can do, and maybe go forward and have some ideas about how to prevent it in the future. While I don't have any technical, financial, or political disclosures to make today, I do have to say I am a third-year pediatrics resident with 2 kids and a wife, so I do have a little bit of a vested interest in maintaining wellness. So I am not legally supposed to have anything disclosed, but I do have some personal reasons to want to explore this topic. And I know better than to tell y'all that I have kids to a room of pediatricians and not show a picture, so there's my kids right there. So let's start with defining what wellness is. So the World Health Organization, in its constitution, written in 1946, wrote that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmary. And I thought it was pretty interesting that this was written all the way in 1946. This idea of holistic wellness, not just in infirmity or, physical capacity. The idea of social, emotional, and physical well-being all in one has been around for a long time. And that's going to be something I go back to over and over again. This is not new age stuff. Burnout has been something we've been dealing with for a long, long time. So just keep that in mind going forward. The National Wellness Institute definition of wellness is an active process through which people become aware of and make choices towards a more successful existence. So this is more of your hippie definition, right? Wellness in their eyes, is a state to thrive in. So here are two separate definitions I don't think are, they're not exactly the same, but I don't think they're in conflict either. So going by the National Wellness Institute definition of wellness, there are really 6 dimensions of wellness. There's occupational, emotional, intellectual, physical, spiritual. I think I went out of order, guys. Emotional, physical, intellectual, occupational, spiritual, and social. And the 6 of these put together form what the National Wellness Institute defines as the wellness wheel. So I'd like to go into each of the 6 dimensions and kind of tease them out a little bit more and examine their aspects. So physical wellness is probably the one to start with because it's the most substantive. It's probably the one that we are most familiar with in the medical field. We maintain our physical wellness with regular physical activity by eating well, getting adequate sleep, which I know you all do, and seeking medical attention whenever we need it. I know what you're all thinking. This is the man that needs to teach me about physical wellness and mental wellness. But it's important. The physical needs are the bottom of Maslow's pyramid of needs, right? I mean, if you're not meeting your physical needs of, just sustaining your own life and safety, you're not going to get much further than that, right? So our next aspect or dimension is emotional wellness. This is awareness of your own emotions, this acceptance of your own emotions. It also allows you to assess your own personal limits. This is where our stress coping capabilities come from. Really, the emotional dimension is a lot of your reactive type potential. It's how you absorb information, how you process that information, and it's how you relate to others. Not necessarily how you communicate with other people, but how you relate to others. So this is really the formation of empathy, right? Which is so important for us as physicians, and especially in pediatrics, I think. Intellectual wellness, this is your education, your mental faculties. You keep up with this by reading, by writing, by studying, doing prep questions. This is our capacity to develop and learn new skills. And a healthy intellectual life really bolsters your ability for critical thinking. One thing that I thought was interesting that the National Wellness Institute kind of puts out about the intellectual dimension is, as kind of like the emotional dimension is our reactive side, intellectual is our proactive side. It's being able to predict and to plan and kind of assess stress before it comes on to us, right? It's able to look at patterns that we've seen in the past. Oh, somebody's getting up and they're stomping at me and they're yelling. They're very angry. I need to leave. Go, go, go. Recognizing patterns and being able to avoid stress preemptively. The occupational wellness, which is kind of the cornerstone of this talk, is satisfaction and enrichment within one's occupation. Now, that's not necessarily a career. It could be in whatever you find that satisfaction within. So maybe you're really into volunteer work. This is still that dimension, even though it's not your actual job or career. This is where we develop a sense of personal worth, kind of our own personal meaning in the world, right? As opposed to the spiritual dimension, just not necessarily religious, but it very well could be. Spiritual dimension is more about finding meaning within life and humanity itself. It's basically developing a worldview. The spiritual dimension is very useful in kind of resolving the dissonance between the external forces and the internal forces. You use your own worldview to kind of resolve conflicts between your own beliefs and values and what you observe to be kind of counter to that on the outside world. And finally, social wellness is pretty self-explanatory. It's your relationship with the community at large, right? This facilitates good communication, the ability to interact not just with your own peers and the other people around you, but with your environment itself, really. And so this allows you to become an active participant within the community. So a lot of other wellness-type talks and organizations kind of base their models off of National Wellness Institute model, but they tend to add a couple. Like here we have environmental and financial dimensions that have been added. I chose to not do that for my particular talk just because I feel like these kind of fit in pretty well within these. But just know that if you do look into this more, you probably will come across 8 dimensions as opposed to 6 dimensions. So going back to our basic wellness wheel, how can we make this fit within the medical community at large, and specifically a residency? Occupational is obvious, right? I mean, it's our jobs. We've gone to undergraduate for this and gone through the MCAT, and then we've done medical school, and we've all proven that we want this, that we're called to this, right? So that's really easy. The other ones get a little dicey, right? I mean, we all know residents are the perfection of health, right? They all eat well, they sleep well, they're not drinking Monsters. Anybody got a Monster today after last week? No? Okay, good. So this, our obsession with making other people healthy while neglecting our own health leads to a lot of imbalance. Same thing with emotional responses, right? It's kind of classic for doctors to be able to go and talk to patients and help patients deal with their stress, but we ourselves kind of let our own interpersonal interactions kind of fall, and we aren't able to deal with stress as well. It leads right into social, whereas, some of the hardest people to talk to are doctors, right? I mean, in a field where communication is key, it's really surprising how often communication breaks down. So, as you can see, there's a lot of places here where life can become unbalanced. One of the reasons I picked this model when talking about residency is one of the reasons the National Wellness Institute put this together is to show that not only is wellness about input, it's not like you're out in the community sucking up all the spiritual energy, but they say that once you're well, once you're balanced, you're able to give that energy back, right? And if you are a good communicator, if you're an effective communicator, you're able to go out and talk to people and show what an effective communicator can be. If you are intellectually very well, you're able to spread that knowledge, right? You're able to educate. So I think one of the important things to talk about when talking about wellness in residency and even going on to be an attending is we want to be effective educators going forward. We want to be effective communicators. We don't want to just hoard all of those gifts for ourselves, right? We want to spread it to our patients and to our eventual medical students and interns and residents that will eventually work under us. The other thing to talk about here is when I think of the wellness wheel, I don't think of it as a wheel. I think of it more as like a plate. And right here there's a rubber ball, right? Right under that wellness wheel. And so it's all about balance, right? It's all about making sure one of your dimensions isn't more overdeveloped than another, because that's what's going to tip the scales, right? That's what's going to set you off balance. So now that we talked about wellness, let's talk about unwellness, right? So let's talk about burnout. Burnout is actually surprisingly hard to define. There's a lot of very varying definitions of burnout out there. For instance, the ICD-11 writes that burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized by 3 dimensions: energy depletion or exhaustion, mental distance from one's job or cynicism related to one's job, or reduced professional efficacy. Now you can see, going by this definition, this is very, very, very work-focused, right? This is very career-focused. Not all definitions are like that. For instance, the Agency for Healthcare Research and Quality, which is an agency within the Department of Health and Human Services, defines burnout as a long-term stress reaction marked by emotional exhaustion, depersonalization, and lack of sense of personal accomplishment. This is a much more general definition, and I feel like it's more applicable to more people. So just between these two sources, I think you can see the definitions are very different. And so a consensus on what burnout actually is really hard to reach. An article I read called The Prevalence of Burnout Among Physicians looked at 182 studies about burnout, and there were 142 different definitions of what burnout is. There was no consensus among them, so that means that the overall burnout range found within this literature review ranged from 0% to 80.5. That's any burnout symptoms at all. So you can see that it's dangerous to talk about burnout without knowing exactly what you're talking about, because somebody could very easily pull up a study and come up here and say, burnout's not a real thing, it's 0%. Whereas somebody else can come and kind of inflate the numbers of the physicians that are actually feeling that. So for the purposes of this talk, I'd like to go with the Maslach burnout inventory. So this was an inventory developed in 1981 by somebody named Maslach. We'll talk about her later. So this is designed to assess for occupational burnout. It's important to note that this is not specifically medical, but it has been mostly employed to study medical burnout since the 80s. There's 22 items on it, and it looks at those three things we talked about earlier: emotional exhaustion, depersonalization, and a lack of a personal accomplishment. There are a lot of, much like the definition of burnout, there's a lot of variations based off of this inventory, but most serious studies about burnout will use the Maslach burnout inventory in some capacity. So going forward, I will be using the definition of emotional exhaustion, depersonalization, a lack of sense of a personal accomplishment, not necessarily solely due to a career field. So let's see. So looking back at that definition, let's kind of dissect it a little bit. So it's characterized by emotional exhaustion, so that's emotional dimension, depersonalization, so that's the social dimension, and a lack of certain sense of personal accomplishment, so that's occupational, right? All this is an explanation of the wellness wheel. You can see already that burnout and wellness are tied hand in hand. They're talking about the same things. It's just opposite ends of the coin, right? So going back to our WHO definition of health, we can see that is a complete physical, mental, and social well-being, right? Burnout is not just career stress. It's not just being overworked. This is an actual health issue. This is a problem that is not being fully addressed. It's a wellness issue for all of us. So what does this mean for us and for the community at large? Well, $4.6 billion is lost every year in the United States because of burnout. That amounts to $7,600 per physician each year. That's an extraordinary amount of money. And besides the monetary side of it, you're seeing a lot of doctors leaving practice. You're seeing poor communication between patients and physicians. It's leading to global distrust in the medical system because we're not able to talk to people anymore. Physicians suffer from impaired attention, memory, executive function, which is all leading to adverse effects in our patients. Burnout doubles the risk of adverse patient incidences. That's insanity. It's really dangerous. And on top of all this, physician suicide rate is double the general population. So this is a huge problem. Based on looking at causes of burnout, I found some really interesting things. I looked at the Minimizing Error, Maximizing Outcome study, which surveyed 422 family physicians who worked in 119 clinics. They talked to almost 1,800 patients from those clinics and reviewed the charts of all these patients looking for adverse events. What they found was that certain work conditions were associated with burnout. They found that time pressure, the idea that I need to see more patients, was one of the big ones. They found that chaotic environments, unstructured workplaces was a big cause of burnout. Low control over work pace, that kind of goes back with your time pressure. Unfavorable organizational culture, as in, your colleagues and yourself didn't get along, your beliefs weren't kind of in line. And electronic health records, which none of us can relate to that, right? We all love Epic here. I found another study that I thought was pretty interesting, looking at work-life balance in Korean gastroenterologists. So this study showed an increased prevalence of mental, physical, GI, musculoskeletal issues within gastroenterologists based primarily on amount of time worked. Notably here, young women were more at risk due to domestic demands. As Dr. Broussard delicately put it yesterday, these ladies don't have wives to go home to, right? They have to go home. They're finding themselves having to be mom, having to be the wife, when they still have such a demanding career. So this is why I think it's almost irresponsible to just go with a career-based definition of burnout, because it completely neglects significant portions of your life. I mean, I don't go home, the only stress in my life is not being a resident. A significant portion of the stress in my life is because I'm a resident, but I still have stress associated with being a son, with being a father, with being a husband. And to neglect that in your assessment of somebody's well-being, it's just dishonest in the long run, at least in my opinion. So who do we see as burning out? The short answer is pretty much everybody, or at least half of people. Some studies I saw said maybe as high as 78%. That's probably a little high. It's probably closer to 44%. Most of the sources I saw had it really close to 50%, having any kind of burnout symptoms. And like I alluded to earlier, we used to think of burnout as this, the surgeon, the trauma surgeon who's been practicing for 40 years, who's seen like 8 million people die and has just grown tired of it. And that's still part of it. The surgical subspecialties are still some of the ones that have the highest burnout rates. But we're seeing more and more now that bureaucratic tasks and charting obligations, non-clinical duties are leading to burnout just as much as demanding clinical duties. So if you look at rates of burnout by specialty, this is the Medscape National Physician Burnout, Depression, and Suicide Report from 2019. This is a survey of 15,000 physicians across 29 specialties, designed mostly to kind of see exactly where burnout is happening. And you see, you have urology up here. That's the highest rate, at least reported this year, and that was 54%. That's kind of what we expect. It's a surgical subspecialty. It's very demanding. It's very high octane. But if you look, internal medicine, emergency medicine, family medicine, the top up here, those are all beating general surgery. We're not seeing, and if you look at the cited reasons, it's all bureaucratic issues. It's non-clinical work. It's having to fight with electronic health records. We are going to see a huge shift, and we're in the midst of it now, where we're going to have to redefine what we think about burnout. And it's not just physicians, right? It's residents, it's medical students. The career we have chosen for ourselves is a very stressful one, and it's stressful from the beginning. Medical student burnout rate ranges from 28 to 45%. And resident burnout rates range from 25 to 75 based on specialty. Those are huge numbers, right? And this is before you even go out into practice. This is in training. So I do have this is a little bit of an older study. This was from 2009, looking at rate of burnout within residencies themselves. But this was still the most comprehensive source I could find. So I wanted to kind of demonstrate it to you guys. This is only half of it. I'll show you the other half in a second. But you're seeing percentage of anesthesia, percentage of emotional exhaustion, 34%. Burnout rate in dermatology, 50%. Burnout rate in family medicine at this time was only 27%. It's much higher now. Look, internal medicine, residents with high emotional exhaustion or depersonalization, two of three criteria that we're basing the definition of burnout on, 76%. It's a huge amount. Here's the other one. Let's see, we got ortho, moderate to high emotional exhaustion and depersonalization. Pediatrics, residents with both high emotional exhaustion and depersonalization, 75%. And what I think is more egregious about those numbers is that it was a 21% depression rate within pediatrics residents. Remember, this data was from 2009. I found an article from 2019 that estimated a 11% clinical depression rate in PGY-1s, in peds interns. Again, they're just starting their training. They have 2 more years to become cynical and dead inside, right? So, again, 41% of pediatricians are going to burn out. That was based on the Medscape poll. You see, we're just about in the middle. And 75% of residents with emotional exhaustion, depersonalization, with what I think is a huge depression rate. We're supposed to be the happy people, right? So, what do we do about it? How do we address it? Really, from what I've seen, the literature points into 2 kind of distinct ways. There's organizational combating of burnout, which is basically system-wide changes. This is limiting the number of hours you can work or hiring scribes, that sort of stuff. It's something that the organization can do to limit an individual's burnout rate. The other one is individual. So this is something that the individual does due to an assessment of their own wellness profile to limit the amount of burnout that they're going to have. So looking at some kind of novel ways to look at organizational burnout, I read one study that kind of looked at whether or not scribes would help, since we're seeing such an increased burnout rate due to non-clinical duties. And so they had MDs with scribes for 3 months, and then they had no scribes for 3 months. And what we saw was that with the scribes, physician satisfaction increased by 17%. Time spent on charting was effectively halved, and there was no change in patient satisfaction. So that's huge, right? That's something that I think on an attending level, it's really interesting. And I think certain cost-effective studies have been introduced to kind of look into that. I've also found this study, Physician Burnout and Wellbeing, a Systematic Review and Framework for Action, that looked at burnout and potential interventions against it. On an organizational level, the 2 most highest strategies that had the best effects were aligning personal and professional values. For instance, this was people who entered into practices that shared spiritual beliefs or something, that didn't feel pressured into practicing medicine that they didn't feel comfortable with on a personal level. And then the other intervention that they found the highest efficacy with was allowing 20% of work activities be devoted to personally meaningful activities. So you essentially let the staff decide what they wanted to do. And, it had to be an actual career thing. But this is like letting surgeons pursue certain cases, right? It's not making them meet a certain quota for a specific type of case. It's allowing them to do what they want to do. And this saw a lot of decrease in the burnout rate. But we're residents. Like, we have limitations that attendings don't, right? I mean, can we really afford Scribes for every resident? No. And even if we could, that's irresponsible because we're essentially limiting our own education on how to write a note and what to look for and developing that kind of focused interview skill that we need. We have a curriculum that we have to follow. There's a little bit of wiggle room as far as electives. We can pursue what we find meaningful there, but we can't completely rewrite our entire curriculum just to do what we want to do. We have to be exposed to as much as we can, right? So it's not like we can just give everybody 6 months off at a time because we're not seeing enough patients, right? We still need to finish our residency on time. We still need to see enough patients that we can responsibly see patients as an attending later on in life. And then there's the fact that, Dr. Broussard and I talked yesterday, and we brought up the fact that there's at least preliminary conversations about, well, do we need to increase the length of residency so we can give more people a little bit more time off? So do we take a 5-year residency and make it a 7-year residency? Problem with that is you're adding stressors later on down the line, right? I mean, we all have loans. We all have financial issues. Making you stay a resident for longer isn't necessarily going to alleviate that. It's just going to tip your wellness balance in a different direction. And there's so many other problems to face when having to deal with wellness and residency. So I thought it might be a good idea to look more specifically into individual burnout prevention. So there was a study that looked at a survey of OB/GYN residents. There was 4,999 because that 5,000th OB resident just wanted to be difficult, right? Just wanted to mess with us. And this survey was really geared to looking at burnout rates and personal activities. And the personal activity is basically anything that is done twice weekly or more. So they looked at hobbies, they looked at exercise, they looked at socialization, they looked at meditation, yoga, all this stuff. And really the 61% of all of these residents were reporting signs of burnout, and the only regular activity that seemed to be related to a decreased burnout rate was physical exercise. Pretty much everything else had no effect except for alcohol consumption, which effectively raised the risk for burnout. And residents consuming alcohol greater than 4 times weekly were at greatest risk. I saw several people wince just now. It's probably not a good sign. So in this particular population, physical activity was really the counterbalance that allowed burnout rates to go down. Whereas in this study, where they looked at introducing a wellness curriculum to anesthesiology residents, it was more of a socialization. So what happened was they brought in didactic lectures, they brought in regular surveys, and they brought in group sessions that was specifically geared to wellness. What they found was that group wellness sessions, essentially like Feelings Friday for family medicine, where they get together, they were off-site, and they just talked about what they were going through. This saw a significant improvement in depersonalization with no effect on emotional exhaustion. So you're still spent, you're still stressed out, but at least you have connected with another person. There was a single aspect of burnout that was alleviated. And I thought that this was really funny, so I just included it. A direct quote was, didactic workshops and wellness-related grand rounds had no effect on burnout symptoms. So I'm sorry for doing nothing for you guys today. So other possible solutions that have been explored somewhat by individual studies are mentoring, meditation, counseling, socialization, and a bunch of other stuff, more stuff that I could ever read. And all of them found varying degrees of success. There are some studies out there that show meditation is great for burnout. There's some that show meditation doesn't do anything. I think the important takeaway from this is that individual groups respond to individual treatments differently. I think one of the explanations you might be able to glean from this is that people drawn to certain fields or people undergoing certain experiences may have the same deficits. So you might see individual groups responding to individual treatments better, but not everything is going to work for everybody. So I think what's most important going forward is development of an individualized wellness inventory, which we don't really have a great source of right now. We all take the wellness inventory every year. Are we supposed to? Dr. Cooper, how good are we at that? Taking the wellness thing every year? Pretty good? Whenever we do it. Yeah.
Semi-annual, you have to have that.
We have to have. So, and that's an ACGME requirement.
As we're using a modified quite as
And
long.
there is and there are there's a lot of variability there. There's some that are only 5 questions. There's some that are 10. But I think the push going forward is going to be for development of a concise survey, because nobody's going to want to fill out a 100-page questionnaire every 6 months. But one that really looks at individual issues in regards to burnout. So I did find a study that was it was essentially a new wellness scale that was developed. It was the beginning of the year, January 2019 is whenever this was published. It was a 10-item index. It was a concise questionnaire, and it was designed that it could be followed longitudinally. So basically, they the same way we use it, right? They take it when they first come in. You take it every 6 months, and you follow throughout the residency. And they found that individualizing wellness scales, not just necessarily looking at are you burnt out, are you tired, are you exhausted, but looking at individual aspects, social, psychological, all of these things, they really saw a lot more data than they had been seeing previously. They were able to assess for meaningful work, which is essentially a measure of, of having that. Oh goodness, for having sorry. I'll go back to that. So, life security, institutional support, and social support. It's. I am very sorry, guys. What did I can't think of the phrase. Personal accomplishment. Woo! So, meaningful work is basically their assessment for a sense of personal accomplishment. Do this. No, can't do that. So, and I kind of alluded to this earlier, but really it all comes back down to Maslow's pyramid of needs, right? We need to meet certain wellness criteria before we can ascend. But the problem with that, I think in this particular case, is we're almost requiring people to reach self-actualization before we ever meet their needs. We're asking people to tell us exactly what they need, where their trouble points are, where their deficiencies are, before they ever learn them, right? Because for those of you who aren't familiar with the pyramid, which I'm sure everybody is, in order to get to the next level, you have to meet these needs, right? You have to have food, water, clothing. You have to have security. You need to develop friendships. You need to feel a sense of accomplishment before you can ever reach self-actualization. Self-actualization is sort of this drive to know yourself better, this drive to reach your full potential. And so the problem we are at currently is that we have these residents coming, and they're saying, my needs aren't being met. And then we go, what are your needs? And they say, I don't know. I haven't gotten to that point yet. So I think there's a lot of good forward momentum. I think we are moving in the right direction, but I think we have a long way to go as far as maintaining wellness and fighting burnout. So, in conclusion, I hope we can all see that wellness is a balance, right? It's not about one's health. It's partly about one's health, but it's also about nurturing them as a human being. When we get imbalanced, we get burned out. And everybody's going to get imbalanced at one time or another. Treating resident burnout like attending burnout, it's not going to help. It's not the same thing. They're very different challenges. But being able to establish a wellness profile for an individual is the key to really fighting off resident burnout. So, told you how we talk about Maslach again. She's the one that created the inventory that defined burnout for us. And I came across this while looking at other studies, and I thought this was a great quote. This is from her book, Burnout, The Cost of Caring. This was written after her landmark paper about burnout came out, in which she established the index. And it says, if all of the knowledge and advice about how to beat burnout could be summed up in one word, that word would be balance. Balance between giving and getting, between stress and calm, balance between work and home. And I think that is incredibly powerful, incredibly pertinent. And she said this in 1982, 37 years ago. This is nothing new. We're getting better, but we still have a long way to go. So, any questions for me today?
So, put your pyramid back up there.
Yes, ma'am.
What does the purple say?
Are you asking me or somebody else?
Anybody. Food, water, warmth, and rest. How many of y'all get one of those a day? 2, 3. A few of you get all 4 of them? Right.
You guys need to be at work more.
Most of you, so if you've ever been in the team room and popped your sandwich box open at 3 o'clock in the afternoon, my first question is, who died between 11 and 1? If nobody's dying, you need to go eat. If you don't take care of yourself, you cannot take care of the patients. Every one of us wear fleece, because there's 2 temperatures in the team room. Hang meat is one of them. So, like Tucker said, if you're not even getting food, water, warmth, and rest on a regular basis, how can you tell us what else you need? And so one of the things Dr. Cooper and I just whispered over here, y'all are doing ILPs, individual learning plans. You probably need to be doing IWPs also, individual wellness plans, because it is individualized. But you've all heard me say, if you don't take care of yourself, you cannot take care of these patients. I've been burned out, been there, done that, actually quite recently. If you're not happy at home and you're not happy at work, you're not going to take care of yourself, and then you can't take good care of the patients.
The other thing that's different about residency is that you change every month. So if you're doing the wellness survey and you've just finished an easy elective, you're going to fill it out differently than if it's February and you're on the ward.
And you were in the PICU last month, and you were in the NICU the month before.
But from that OP study, it looks like the one thing that seemed to help the most was exercise.
Exercise, yeah. And there were several studies that I found that came to similar conclusions where physical exercise, and it makes sense. Physical exercise is the most important thing you can do to keep your body and your mind right. There are other things that help, but the thing is,
Maybe I could, but I feel like it's a little illegal for me to like make you guys exercise. So, but yeah, no, physical exercise, and that's probably the one thing that kind of slips through the cracks the most, because I don't have time.
You don't need time. You can lunge down the hallway and take on the floor. It's a long hallway. That's a whole lot of lunges.
Or you can be late for your own grand rounds and run up 3 flights of stairs, you know?
You know, and if you really want exercise, grab one of the Nelson's textbooks and put it in your backpack and carry it around all day. Easy stuff. You don't have to go to the gym to get exercise. Yes, do curls with those Nelsons. It's a 2-volume series.
Hey, Dr. Killigan.
The presentation, Dr. Very good. I guess the rest include also sleep, right?
Yes.
Sleep is important. I'm a big sleep advocate as well. But the sleep actually, when it's very busy residency, you probably won't get your 8s. I always say get your 8s. Means 8 hours of sleep in 24 hours. If you can get, that's a great. But if you cannot, try to see how can you compensate for that. Always you will have sleep debt, right? So in a week, suppose you are in night float or something, you will have sleep debt. So try to compensate that in a 7-day period, probably like a weekend or something. Other thing is, I believe in micro nap or power nap. So that is actually, it will work, especially if you're sleep deprived or something. The power nap or micro nap is going to work. You're going to go into N3 stage directly in that power nap time. So if you can do a nap in 10 to 15 minutes, that will be effective, very effective actually. So, for example, you have some downtime, just get a very small power nap. That's going to help. 1 or 2 power naps in the 24-hour period is going to help. Other thing is, suppose you're a night float for a week and then you're working overnight, you're busy, you're not sleeping properly. Next day you have the whole day. So you may go home, watch something like that. But one thing very importantly, you have to get the sleep cycles, at least 2 or 3 sleep cycles. One sleep cycle will last for about 90 minutes, right? And then if you're sleep deprived, you will go into that sleep cycle very quickly. So your sleep latency is going to be very, very small. So you try to get at least 3 sleep cycles. So that means how many hours? 3 sleep cycles is going to be
90 minutes.
90 minutes. So
3 to 4.
4.5 hours.
Yeah.
So if you can get 4.5 hours of sleep in the daytime in the rock, you have to come back for the night again, right? That is going to be very, very effective. So like these things work on this circadian rhythm, physiologically, it works on the sleep cycles. So those are things I think my recommendation in terms of sleep.
And I did see I read an article that was looking at, instead of duty hours or clinical hours, it was looking at number of times a surgery and internal medicine resident was paged overnight as an indication of work. It was pretty interesting, but there wasn't quite enough meat on the bone to include it here. But one of the things that they discussed was the fact that, the little rest that they were getting overnight was continuously interrupted by being paged, and taking pager away really helped with their daytime duties. So it's kind of interesting.
One thing too is, I know you mentioned that interns are burned out, which I think if you had to survey interns, second years and third years, interns will probably be more burned out, because I think I was burned out as an intern. It's new, it's different, you're learning so many things, it's overwhelming. So I think for residents, you guys need to remember how you felt when you were an intern, when you knew nothing. And you need to be patient and kind with your interns, rather than being in a hurry. Oh my God, he doesn't know this. Don't roll your eyes. See if you can sit with them and just help them, because it is really overwhelming. And for me, one of the things that helped, aside the family support I had, was I had very good senior residents. When I was an intern, my senior resident was Billy Branch, and it was super patient, and it kind of showed us everything. So just be patient with your interns, because everyone feels it's a different feeling. When you become a second year and you ask, you're like, oh my God, this is so much better, because intern year is really hard. You don't know what you're doing. So resident as well, you need to be kind to your interns and just be patient with them. Some people are going to pick up things really fast. Some people, it's going to take them a while. That's just the way it is. We're all not perfect. Some people are stronger in one aspect than the other. So just take that extra time and be compassionate to one another, and notice how people are feeling, and check on each other. Have you had lunch? Go get lunch. Just we need to give each other that kindness to kind of help us all function and be better people.
Thank you very much.
I know you also kind of came across like the culture of work as you were kind of reading about this, especially in medicine and in the United States. I think like as kids we're told like if you work really hard, like good things will happen to you. And I think we've kind of created this toxic culture of sort of investing in things that may not be good for us.
Yeah.
So especially in residency, you know, you hear a lot of like, oh, so-and-so took a lunch break, like they're so lazy, or so-and-so, you know, or oppositely, you can have, oh, so-and-so works really hard, they like picked up 3 extra shifts, they're so great, and we're praising behavior that's probably not healthy, and then the people who are taking care of themselves are kind of being labeled as, you know, lazy or not team players. So I wonder, you know, did you come across that?
I didn't really, nothing specifically about the culture and fixing the culture. There were studies that show that, you know, malignant kind of organizational cultures will absolutely lead to burnout, and I think that's part of it. I mean, I think if you're, you know, you set up quotas or you know, that sort of thing where it's just the drive to see more and more and more and more is one of the leading factors of burnout. It's, you know, it's time crunch. It's all the stuff that I brought up. I hadn't read anything about, you know, any studies that looked into changing the actual culture of it, but I think that's probably the way that we're headed. So yeah, nothing specifically, but I mean, you're absolutely right. That sort of thing is problematic, and I think will be addressed in the near future. Anything else? Well, thank you guys.